All right. Good afternoon, everyone, and happy Halloween. It is 1 p.m. on the East Coast of the US, where it is 8:35. My name is Rikus Christensen, and I'm happy to welcome our in-person and online audience to today's presentation. But before hearing from today's speaker, I want to alert you to our talk in 2 weeks' time when Dr. Maria Orkanitsa from Boston University will present her work on vascular brain health and aphasia recovery. Today, however, it gives me great pleasure to welcome Dr. Jee Eun Sung, professor in the Department of Communication Disorders at Ewha Womans University in Seoul, South Korea. Dr. Sung completed her PhD in Communication Sciences and Disorders at the University of Pittsburgh, and she has since dedicated her career to advancing cross-linguistic research and promoting scholarly work on underrepresented languages. She directs the Neurogenic Communication and Brain Lab at Ewha Womans University, where her research focuses on aging, aphasia, and dementia-related linguistic cognitive assessment and intervention. Her research integrates diverse technologies, including neuromodulation and neuroimaging, to enhance understanding and rehabilitation of neurogenic communication disorder. And today, you'll hear some of our work on cross-linguistic and multicultural framework in aphasia assessment. Please feel free to write your questions in the chat during the presentation for Dr. Sung to answer at the end of her talk. And with that, I'll give the floor to you, Jee.
Hi, everyone. Can you hear me well? Okay, sounds good. So can you see my screen well too?
We could just a moment ago, but now I can just see the background on your screen.
Okay, let me just reshare it. Is it better?
Yes, perfect.
Okay, sounds good. So let me just move my, okay, sounds good. So everything works good now? Okay, let me get started then. All right, thank you so much for inviting me to the C-STAR lecture series. I'm truly excited to be part of it. And my students and I in Korea have been a long-time fans of the C-STAR, which is an incredible research platform for sharing and disseminating valuable research all around the world. And I'd like to thank the team for organizing this event. Okay, so let me move on. So the work, okay. So the work that I'm presenting today is all about the collaborative efforts from all around the world. And I have been collaborating from North and South American teams, such as Swati Kiran from Boston University and Gail Didi from Temple University. And in the West Coast, Marilu Gorno Tempini and Brunette T and Adolfo Garcia for just... Okay, let me just minimize my view. Okay, so from Adolfo Garcia from UCSF and included team. And from East Asia, I have been collaborating with Seung-Hoon Lee from Japan and Juen Lee from Hong Kong. So I'm going to be presenting some of the tables of contents are as follows. I'm going to begin with some of the cross-linguistic framework first, and then followed by the data-driven evidence on cross-linguistic research in verbal fluency for people with aphasia and older adults with Alzheimer's disease and aging across diverse languages. And I'm going to briefly cover some of the evidence from the BNT, Boston Naming Test, cross-linguistic evidence in people with aphasia. And finally, we are going to briefly go over cross-linguistic evidence in sentence processing for people with aphasia as well as aging populations. Okay, so part one. So I'm going to briefly go over cross-linguistic framework. As we all know, bilingual and multilingual populations with neurogenic communication disorders are increasing very rapidly, and it is very crucial to consider an overarching theoretical framework that helps us understand the nature of linguistic deficits arising from cross-linguistic differences and similarities between these two languages. And tutorial paper on this cross-linguistic framework just came out last year. And in this paper, we proposed a cross-linguistic framework for clinicians and researchers to consider when working with the two language users, whether typologically similar, such as English and Spanish, or structurally dissimilar, such as English and Korean. So under this paper, we briefly cover three different domains, such as morphosyntactic levels and lexical-semantic levels and phonological levels. And under the morphosyntactic features, we talked about a little bit about word order differences and prodraft features and morphological inflections. And under the lexical semantic differences, we dealt with cognitive effects as well as frequency and typicality effects. Finally, for the phonological differences and similarity parts, we talked a little bit about segmental features and suprasegmental features to consider. I strongly recommend, anybody who are interested in cross-linguistic studies to read this tutorial paper to cover all of the diverse dimensions of the cross-linguistic differences and similarities. So let's move on to the hard evidence of data-driven similarities and differences on cross-linguistic differences in verbal fluency. Let's just begin with the people with aphasia first. So this work was presented at the Clinical Aphasiology Conference in 2024 last year as a JEDI platform presentation, and the paper just came out this year in HSLP. And this paper is about animal verbal fluency task. As we might all know, verbal fluency task is generally administered within 60-second paradigm, and we use the animal category for the semantic verbal fluency. And this specific verbal fluency task must have been influenced by psycholinguistic factors such as lexical frequency, semantic typicality, and imageability, as well as ethnographic aspects, such as cultural differences, environmental factors, and educational backgrounds. In this paper, we specifically focused on the zodiac-related culture from East Asian because we wanted to make sure whether this verbal fluency tasks are influenced by the cultural differences. So zodiac animals cycle through a repeating 12-year sequence, and this culture may influence the semantic space of East Asian language users. So basic hypothesis to test is that lexical semantic representation can be influenced by the linguistic and cultural backgrounds. To test this hypothesis, we addressed the research questions as follows. We first asked whether there are significant differences in the total number of correct responses between English and Korean speakers with aphasia, as well as in the number of zodiac animals and in the ratio of zodiac animals. And finally, we asked which animal items are the most significant predictors in differentiating these two language groups for each people with aphasia. So 37 Korean-speaking individuals with aphasia and 30 English speakers with aphasia participated in the study. And we matched for the aphasia quotient as index of the aphasia severity. However, the age and education were not able to be matched. So we put these two variables as a covariate in the analysis. So for the analysis, we first analyzed the total number of correct responses and number of zodiac animals and ratio of zodiac animals. And these are the results. So the English speakers produced more number of correct responses than Korean speakers. However, the patterns were flipped when we used the culturally salient features of the ratio of the zodiac animals as outcome variables, indicating that Korean speakers with aphasia generated greater ratio of zodiac animals compared to English speakers with aphasia. So for the item-based inventory analysis, we found that there are 46 language general items such as dog and cat and lion, and we ended up with 25 Korean specific items such as these items and 51 English specific items. So to determine the best items to differentiate these two language groups, we performed lasso logistic regression analysis, and positive coefficients indicate the item associated with English-speaking individuals with aphasia, and negative coefficients indicate this item is associated with Korean speakers with aphasia. So interestingly, for people with English speakers with aphasia, alligator was the strongest predictor, while the tiger was the most predictive item for Korean speakers with aphasia. Tiger just not only belong to the zodiac category, but also historically and geographically, tiger has very interesting meaning in Korea. Sometimes tiger can be visualized as a Korean peninsula as a symbolic animal, as well as tiger very often appears in the traditional narratives and folk story in Korean. So suggesting that this cultural context can influence verbal fluency task performance, that was the main findings and implications from the study. So part two, however, we were not sure whether it's just, happens to be found for people with aphasia, for Korean speakers and English speakers only. So we wanted to make sure whether this finding can be replicated in other populations with neurogenic communication disorders. So we applied these methods to older adults with Alzheimer's disease. So basically, we replicated the methodological procedures as previously done in people with aphasia. However, we additionally added clustering and switching methods in this current paper. So clustering meaning the subgroup of the superordinate semantic category. For example, ox and horse and pig and dog can be subcategorized, while rabbit, rat, and sheep can be subcategorized as another subcategory of this animal category. So this clustering method is all the criteria for the clustering is from Troyer's et al. Traditional clustering method, and switching refers to switch from one cluster to the other cluster. So clustering and switching analysis are another qualitative methods to measure an outcome measures of the verbal fluency in the literature. So we use this one, and we categorize this clustering and switching methods into two categories. One is culturally agnostic analysis following the traditional Troyer's et al. Approaches, and the other one is called culturally specific analysis following the 12 zodiac animals, as using that zodiac animals as a subcategory following the previous study that we found for the people with aphasia. So specifically, we addressed the research questions as follows. First, do Korean AD produce a higher proportion of zodiac animal responses than English AD? And number two, do language groups differ in clustering and switching patterns across the two analytic framework? First, cultural agnostic part, and two, cultural specific part. And number three are fluency measures, our from cultural agnostic and cultural specific differentially associated with MMSE scores for each group. So these are the demographic information from two groups, and Korean AD were recruited from Seoul in Korea, and English AD participants were recruited and the data retrieved from the Dementia Bank, and we matched for age, sex, however, MMSC, however, the education was not matched, so education was put as a covariate into the further analysis. So first, we explore the response patterns. So among 10 most frequently produced items, Korean participants generated 8 zodiac exemplars endorsed by 77.8% of participants, which is surprisingly high. And Korean speakers most often initiated their responses with a dog, tiger, and ox, all of which are zodiac animals, with the exception of elephant. In total, 88% of first responses were zodiac exemplars only for Korean AD participants. So going back to the clustering and switching analysis, we briefly recap, we used the total number of correct responses, the number of switching, and number of mean cluster sizes from the Troyers et al., and zodiac ratio, zodiac switching, and zodiac cluster sizes from the cultural specific analysis approaches. And here are the results. So the two groups were not significantly different at all in all of the culturally agnostic procedures. However, the Korean AD produced higher ratio of zodiac animals and greater number of zodiac switches and greater number of mean cluster size in zodiac analysis. So furthermore, the correlation results associated with the MMSC. For Korean participants, we used the KMMSC, and for English AD, we retrieved English version of the MMSC. And we found only the Korean AD showed significant correlations between MMSE and number of zodiac switches and number of total numbers and number of switchings from the culturally agnostic parts of the analysis. So to summarize, we found the Korean AD participants showed a strong reliance on zodiac animals, and also the Korean AD in only the Korean AD culturally specific fluency measures positively correlated with MMSE. And this finding highlight the semantic typicality is culturally shaped, and culturally specific categories such as zodiac can enhance clinical sensitivity of the fluency measures in detecting cognitive decline. Okay, so let's move. So that motivate us to further expand our findings across more diverse languages, because I wasn't sure whether this is just only English versus Korean specific phenomenon or not. So we decided to include more languages. So with the help of the Include network, I was able to include more languages. So Include network refers to International Network for Cross-Linguistic Research on Brain Health. And this network was initially initiated by the UCSF group, such as Gorno Tempini and Adolfo Garcia and Bunled T and Jessica. And there are several subgroups of research committees, and each research subgroups are conducting and sharing some of the data based on the specific hypothesis that they wanted to test. So in this data, we wanted to expand our language groups by including English and Spanish and Korean, Japanese, and we wanted to replicate whether this cultural agnostic analysis and culture specific analysis will elicit the very similar results as we found before in the stream of the people with aphasia and AD participants. So we had total of 636 participants and 62 from English and 120 from Spanish, 422 from Korean, and 31 from Japanese data. And we categorized English and Spanish as a Western culture, and Korean and Japanese are driven from the East Asian culture. So we compared this Western culture group different from the Eastern Asia group depending on the culture agnostic and culture specific analysis. So these are the demographic informations. And this is the quick summary of the mean NSD of the descriptive performance in animal verbal fluency task, but it's better with the visual figures as we present here. So on the left two panel, English and Spanish from Western culture, they elicited greater number of total animals compared to Korean and Japanese speakers across the world. However, the mean cluster size was not significantly different at all. That's the quick summary of the culture agnostic analysis approaches. And if we are going to move on to the culture specific analysis, that's the patterns are exactly flipped. As you can see, the Korean and Japanese speakers produced higher ratio of zodiac animals compared to English and Spanish speakers. And Korean speakers and Japanese speakers produced more zodiac switches than English and Spanish speakers. And mean clusters were also significantly different between these two groups. So that was very interesting to us because I think it is meaningful that we replicate the zodiac and cultural specific effects not only in people with aphasia and AD, as well as aging populations who are normal, healthy control, and cognitive unimpaired groups across diverse language groups. Not only English and Korean comparisons, but also English, Spanish as a pair of the Western culture and Korean, Japanese. And as you can see, English and Spanish do perform together, and Korean and Japanese data go well together. So it's kind of the well-grouped cultural specific effects of the animal fluency effects. So let's move on to the cross-linguistic evidence in Boston naming test. So this work was presented at the Clinical Physiology Conference this year in May. And Boston naming test is everybody would know. So this is the very most widely used standardized assessment tool to evaluate word retrieval abilities across diverse clinical populations. And the BNT has been translated or adapted. However, it remains unclear whether adapted version of the BNT differentially impact performance across diverse language users with aphasia. So among various versions, Korean version is one of the most widely and comprehensively adapted version, I would say, both culturally and linguistically, because we ended up with only, shared only 10 items out of 60 with its original version of English BNT. So surprisingly, 50 items were different from the original. And these are the very culturally adapted and modified item from the BNT exemplars. So the purpose of the study was to compare the structural comparability and also the performance comparisons between the two versions of the BNT. So we administered all of the 60 items of the BNT per each language group. And For the structural comparability, we included two psycholinguistic features such as lexical frequency and number of syllables. And for the results, we found that there were not significant differences in log lexical frequency between the two versions of the BNT. However, Korean BNT elicited higher number of syllables compared to the English version of the BNT. And we correlated item order with the psycholinguistic variables. And as you can see, as the item order goes on, the lexical frequency goes down, the syllable length is greater. The syllable length was not significantly different. Both English BNT and Korean BNT item order only correlated with the log frequency. So study part 2 was about performance comparisons from Korean speakers with aphasia and English-speaking individuals with aphasia. So they were matched for age and education and MPO, as well as aphasia quotient from the K-WAP for Korean and English WAP for English speakers with aphasia. So these are the comparisons that we made. So let me just go with the overall performance comparisons between the language groups. These are based on the accuracy, and we found that there were not significant differences between the two groups in terms of the overall accuracy. And we also found the significant negative correlations between item order and accuracy in both Korean and English speakers groups, indicating that as the item number goes on, increases, the performance on accuracy goes down systematically. So we ran the cluster analysis to see whether how 60 items are grouped based on the individual performance from all participants for each language group. And based on the silhouette score, we identified that the cluster number of the cluster might be relevant with the 3. So we used the k-means clustering to analyze how 60 items are grouped, and these are quick summary of the visual representations of the 3 clusters. And we also analyzed the item order and log frequency and log number of syllables per each cluster for each language group. And as you can see, the cluster seems to be grouped together per log frequency, given that as the cluster number goes on, the log frequency goes down systematically for both English BNT and the Korean BNT. As just following the pattern of the lexical frequency here, log frequency, overall accuracy also follows the same pattern. So far, the cluster seems to be clustered together depending on the log frequency, and that's why performance decreases systematically as the lexical frequency goes down. However, interestingly, we found the significant cluster effects as well as language by cluster interaction here, indicating that cluster 2 and cluster 3 there were significant differences between the groups. So, however, in the cluster 1, there were not significant group differences found. So what does that mean? So we just further explore what this cluster means to make sure we correlated each of the cluster performance with overall aphasia severity per each language group. So we found for English speakers, we found overall the performance from each cluster were correlated with the AQ across the board. However, Korean speakers correlated the cluster 2 and 3 performance were correlated with the AQ. However, the cluster 1 did not correlate with AQ only for the Korean speakers. So to summarize, we can takeaway message from this study is that English and Korean BNT versions, we can say they were broadly comparable in terms of the lexical frequency and structural design of the items. And the lexical items frequency, not syllable length, was the main driver to determine the psycholinguistic variables in terms of the structural design. And cluster level distinctions can give us some some clinical implications, given that the cluster 2 and 3 were grouped together with more like a structure, culturally specific items for Korean speakers. So some of the clusters that include culturally specific items are better correlated with the aphasia quotient as indexed by the aphasia severity for Korean speakers with aphasia. So we wanted to expand this analysis to additional language and bilinguals and develop shared psycholinguistic metrics for culturally sensitive but comparable assessment. So these are the quick summary of the results from the BNT. And this is the final part 4 for the cross-linguistic evidence in sentence processing. Let me quickly go through what we did in terms of the sentence processing levels. This work is the collaboration from the US, the Gail Didi from Temple University and Seung-Hoon Lee from ICU in Japan and me. So we included the 3 language groups to further identifying tasks that are sufficiently sensitive to detect subtle impairments associated with aging. And we wanted to develop language general and culturally agnostic sentence processing tasks that can be effectively administered across diverse aging populations with different syntactic structures and lexical-semantic representations. So the motivation of the study is driven from the specific subtests from the WAP. So under the auditory verbal comprehension, there was a C section called the sequential commands. So we do in Korean version of the WAP, we do have the sequential commands as well. However, always, broadcast agrammatic participants with aphasia, they all very hard, they always have very hard time with this specific sequential comments, and that motivated us like to dig into further which components make them more difficult. And however, in this the WAP, there are only a couple of items to be tested, so we decided to make more this test comprehensive by systematically manipulating the semantic plausibility and word order components. So we developed together the sentence comprehension task by manipulating semantic plausibility. Some of the sentences are plausible and some of them are less plausible. And we also systematically manipulated word order, canonical version, and scrambled version. So this is an example of the plausible and canonical sentence version. For example, point to the book with a pencil, and then after they listen to this sentence, then they have to point to the picture that the sentence that corresponds to what they just heard. That's basically sentence picture matching paradigm. Another example is semantically less plausible and scrambled word order. So, for example, with the box, tap the hammer, that's the example of the less plausible and scrambled word order. So we ended up with the 2x2 conditions, less plausible and plausible by word order canonicity. So we included head initial language we include the English as the head initial, and we had 2 had final languages such as Korean and Japanese. And with this paradigm, we investigated whether aging effects emerge when semantic and syntactic features are systematically manipulated. And we further examined whether this linguistic manipulation yield different effects with head initial versus head final languages, as well as within head final languages. So here is the demographic information. We had a total of 317 participants, 103 from English speakers, 106 from Korean, and 108 from Japanese. And we also had the young and old groups for each language group. So basically, we are trying to match for age and education and MMSC for each language group. So these are the sentence picture matching paradigm. And as we already talked about, we had two conditions per plausibility, and we had a two word order canonicity, and also we had head initial and head final language comparisons. And these are the sentence stimuli and picture exemplars for each sentence. Okay. So we actually analyzed the accuracy and response time all together, but due to the time constraint, I'm just gonna go over the accuracy data, and this whole data sets are now under review. So I'm just briefly go over data analysis part for the accuracy only. So we performed the three language groups separately for the data analysis. So for English speakers, we had definitely aging effects as well as surprisingly word order effects for English. So scrambled word order is more difficult. It's more easier actually than canonical word order, which is interesting. We can talk about later if we have time. And for English speakers, we did have group by plausibility interaction going on. So younger adults or older adults, we would say that they had more problems with less plausible sentences compared to the younger groups. However, these aging differences were not significant for plausible sentences. And also here, older groups were more problems to have had greater difficulties in processing canonical word order than the younger groups. However, the pattern was also these differences were greater in the canonical compared to the scrambled word orders. Again, it's interesting why they did have greater difficulties in canonical than the scrambled disorders only for English speakers. We can talk about it later. For the Korean speakers, we had aging effects and plausibility effects and word order effects, meaning that plausible sentences is much easier and canonical sentences are easier, and younger participants perform better than old groups. And very similarly to the English groups, we had the group by plausibility effects. So older adults had greater difficulties with less plausible sentences than plausible sentences compared to the younger groups. And for the Japanese, basically followed the very similar patterns as the previously presented two language groups. There were aging effects and word order effects. And also the group by plausibility effects indicating as consistently with the Korean speakers, the older adults had greater difficulties in less plausible sentences than the plausible sentences compared to the younger group. So this is the quick summary of the results for the accuracy. And basically, they follow the pattern of the plausibility and word order, except for the English speakers, and group by plausibility. If interactions were salient for English and Korean groups as well as Japanese groups. And these are the quick summary of the response time, although I did not go over the details of the response time data, but almost followed the same patterns as the accuracy. So to summarize, the present study represents the first systematic attempt to develop and apply a common sentence comprehension paradigm across diverse languages with distinct linguistic typologies such as English, Korean, and Japanese to investigate the effects of aging on sentence processing and the consistent aging effects observed across the languages despite their typological differences underscore the salience of the word order and semantic plausibility manipulations in eliciting aging-related processing difficulties. And these suggest the potential for developing a language general assessment tool to detect cognitive aging, offering a standardized approach that can be applied across diverse linguistic cultural contexts. And to conclude our talk, we need to consider both the language general and language specific component when assessing individuals with aphasia, taking into account their linguistic backgrounds. And furthermore, it is essential to develop assessment batteries that balance language and cultural agnostic elements with language and cultural specific measures to more accurately identify and characterize the nature of the linguistic deficits in neurogenic communication disorders. And thank you very much for listening.
Thank you so much. Can you hear me?
Yes, I can hear you well.
Thank you so much for a really interesting talk. I think we got some questions in the chat box, but maybe we can start with questions from the room here, if we have any. I don't know if you heard the applause. We're missing the camera facing the room, but I assure you there was, well, we have a lot of audience and a lot of applause. I might start us off with a question while other people are gathering the thought. I just had a question regarding really factors such as lexical frequency and age of acquisition effects. Do you think these contribute to, and how much they might contribute to the differences in semantic content featured on the fluency tasks?
Yes, that's a very great question. And I can see from the chat that Kirana's question about also like a zodiac animals, just a proxy for the psycholinguistic features of the lexical frequency. And I kind of do agree that the, like a zodiac features, zodiac animals are, some of them are very high, do have very high lexical frequency in nature. So I don't even I don't quite remember whether I have looked into the lexical frequency of the zodiac animals items when I analyze them. If anybody in our group remember that, just help me out. So like that's yes. So some of the items are lexically high, but some of them are not. But I think that's a really good point to look into whether how this lexical frequency itself interact with the zodiac kind of subcategory analysis and how these two interactions going on for the accuracy of the performance.
Perfect. Thank you. All right, I might ask another one, which is more of a sort of a broad picture view kind of question. I wonder how do these cultural differences really correspond to or affect differences in like treatment planning, treatment target selection across different geographic areas, cultural backgrounds, and sort of the administration of treatment. And then I'm thinking about, I guess, aphasia primarily, but also Alzheimer's disease, dementia, and other conditions.
Yeah, that's a great question as well. So, yeah, I think that's all why our studies are motivated. So when we, like see the patients who speak two languages at the same time, also for monolinguals who are grown up in the US, but if they just speak Korean and English at the same time, not just it's not very simultaneous bilingual itself, but also like a sequential bilinguals, they also suffer from this assessment related issues. For example, as we see in the BNT, the Korean BNT is very widely adapted version. So some of the items are not that familiar for those who are raised and born here in the US, although they speak Korean. So in that regard, for those who wants to get treatment, uh, so there are two things. Assessment-wise, we have to think about how to like balance these cultural differences and linguistic differences to objectively and like clearly identify the nature of the impairments from language users who have two languages from different typology and different backgrounds. And the other points, as you mentioned, about the treatment approaches, how they, treatment items can be selected from the cultural perspectives and linguistic perspectives. And for example, I just want to share one example that we are treating now. Uh, so, so we have a bilingual participant with aphasia, and he lives in US, but he wants to receive language therapy in Korean, not in English. That's why my students and I initiated the treatment plan for that for him via Zoom. So we are, providing language therapy via Zoom Korea, SLPs are in Korea and the patients in Korean in the US. And the thing is that although he is very fluent in English, he wants to receive the language therapy in Korean, and we wanted to like we were planning to have the Korean specific sentences and the materials, the reading materials, and all the things that are relevant for him to read in Korean. So I think it's very tricky, but I think, depending on the patient's needs and what they want, we, SAPs and researchers have to incorporate their needs into the treatment plans.
Perfect, thank you.
Mm-hmm.
All right, I think that's all the questions from the chat and the room. Just to end us off, maybe since you hinted at this during your talk, maybe you could shed some light on why you see the somewhat unexpected differences between the scrambled and the canonical sentence structures.
Yeah, that's a good question. So I think, I think that's a kind of isomorphic hypothesis. I didn't go into much detail about the theoretical background, the isomorphic kind of hypothesis in sentence processing, meaning that if we think about point to the book with a pencil, then, like in Korean, the canonical word order is the with the pencil the book point to. That's the canonical word order for Japanese and Korean. However, for English speakers, actually, when you have to do the action with the pencil point to the book, then with the pencil is kind of aligned with the first initiation of the action. That's isomorphic hypothesis. Isomorphic meaning that action and the sequential of the sentences are aligned. So in that case, although the syntactic structures is non-canonical because the with the pencil point to the book, that's scrambled word order. It's a very non-canonical for English speakers, but that's aligned with the action. So that's a isomorphic. So unconsciously, I think aging populations find it more easier when the syntactic structures, although the syntactic structures are non-canonical, but when it aligns with the semantic action of the sentences, then they think that it's easier to process. That's kind of the findings.
All right, that makes sense. Thank you so much. All right, that brings us to the end of today's talk. Thank you so much again, Dr. Sung, for a wonderful presentation. And thanks to our online audience and in-person audience for asking questions and listening. And we'll look forward to seeing you again in 2 weeks' time for another C-Star lecture. Thank you so much.
Thank you.